Everyone, my name is Naomi Eisenstadt. I'm a non-executive director on the NHSC board and the Department for Education board. I think we're going to have a really exciting session on this panel with 4 brilliant speakers. Uh, the issue about social value in the NHS has been around for a long time, and of course was the fourth aim in the aims of ICBs. But we do have some concerns that it's falling down in terms of importance on the agenda. So I think what you'll hear from our speakers will be how important it is and what kinds of exciting things that they're doing. So each of the speakers will introduce themselves. I'll just tell them to come on. They'll speak for 5 minutes. And after the speakers have spoken, we will have a chat amongst ourselves and then invite you to ask questions. So I don't want to take up your time and the speaker's time. So to begin with, I'd like to introduce Dave Sweeney, who will take over now. Dave.
Thanks, Naomi. Hi, everyone. Lovely to be here. My name's Dave Sweeney, as Naomi said. I'm the Associate Director for Sustainability and Partnerships at NHS Cheshire, Merseyside. And under the sustainability, it's a big portfolio. It means the green agenda, social value, the Anchor Institute work, and then from a partnerships side of things, which is equally more interesting, I get given a lot of the stuff that nobody else wants. And it's a really exciting portfolio with a really good team. So from a social value perspective, I've been at this for probably 15 years at different levels, and no more so now in this day and age where financial kind of restraints and various other things. Social value is so prominent. Just to give you an insight, so Cheshire Merseyside is one of the biggest ICBs in the country. So that brings some challenges, but also brings opportunity of growth and doing things at a really big scale. So we went out the social value element of things, obviously through our procurement and contracting, making that kind of statutorized and pushing the boundaries in terms of the minimum 10% as far as we possibly can. But more importantly, the Anchor Institute work. So we got really into this about 3 years ago. So we're currently at 43 major organisations, both from a voluntary sector right through to industry. And you'll actually hear from Gerard later on, one of our Roche, one of our significant Anchor Institutes. And 43 organisations with a kind of a responsibility to bring to the table as anchors what they're doing to help the community and what they're doing in terms of added value, what they're bringing. So under that very simple framework, as an anchor, we're able to measure things like workforce, paying the real living wage, the environment, how we're using the estates, and indeed social value. So we're hoping to grow that and keep growing that. And what it brings us is that scalability, and it brings us the opportunity to measure social value at scale. So we've just hit the billion mark thanks to our social value portal colleagues. We've just hit the billion mark. And what it started to do is get into the echelons of our boards. It's getting to the echelons of the people who are running the organisation to say, well, we're a marmot industry. What can we do with this additional, target this additional funding into areas that are signified in our marmot principles and our demographics? And it's really starting a buzz. And I would urge anybody who's thinking of getting more proactive in this area to think about the Anchor Institute kind of model and that kind of policy to drive that real agenda. And the more people you get together, and the more massive people you get together, the bigger it will be. And you'll hear Gerard talking later about targeted responsibility. So at the minute, to really kind of get your DOFs excited is what comes on that bottom right-hand corner of the budget page, where social value won't hit that. But what it will do is, if it's targeted correctly and the right amount of support and money is fiscally put into areas of high demand, we can start to turn that corner and start to move that way. There's one thing to note, and Naomi's just touched on that, is so a little bit disappointed in terms of the blueprint. The sustainability and social value indeed didn't stand out as much as it should have, and that's my belief, and I will continue to lobby and to push that. the fourth pillar of the kind of within the ICBs isn't necessarily as prominent as it once was. So it's up to us, those people who are leaders in this area, to push, to lobby, and to drive that and keep going. Don't get too upset with what's written and what's not. Keep doing what you're doing, because this will, it's the only way forward. It's the only way we're going to turn the tide on health inequalities and health equity. So I'm ramping up to 4 minutes 30. Naomi, I'm going to stop there, and it's been a pleasure. Thank you.
That's brilliant, Dave. Thanks very much. Our next speaker is Rebecca Griffiths. Rebecca, can you introduce yourself, please?
Hi everyone, thanks Naomi. My name is Rebecca Griffiths and I am a Net Zero and Sustainability Lead at NHS England. I also lead on social value policy for the team, and recently very happy that we finally published our NHS social value playbook in July this year. So it was really interesting to obviously hear Dave's thoughts. And I totally appreciate kind of a lot of the challenges that we have in terms of bringing social value to life across the different aspects of delivering healthcare, and particularly doing that in a space where we're really conscious of our financial constraints, our waiting list constraints, but also we have this duty to kind of support our broader local communities through tackling health inequalities and social determinants of health. So it's something that we can't forget. But how do we do that? It obviously can be a bit of a challenge. So some of the ways in which my team and my programme has been trying to support this is through the publication of the Net Zero Supplier Roadmap. And for those of you who aren't aware of this roadmap, it was published in 21-22, and it features a number of requirements on that roadmap to help our NHS suppliers get to net zero. But more broadly than that, it's really been created in the spirit of how can we ensure we have a sustainable, fair and transparent supply chain. So the first requirement on that roadmap is all around social value. And it was the first time that we asked our wider social value, wider NHS organisations to include social value at a minimum of 10% in all NHS tenders. So we've been on this journey, and we've only been on this journey since, I guess, the last couple of years, 3 years. And I think that's something to note in this conversation. We'll have lots of people at this conference this week who've been doing this for donkey's years at a local level. Dave's been in this for 15 years. I am relatively a baby compared to that in this space, but actually this is a fantastic opportunity to work with suppliers like Gerard will talk about today, and how we can collaborate across our commissioners, our clinical leads, our operational leads, yes, our finance and procurement directors, to be able to deliver kind of genuine social impact. So we know, even though we have had this requirement in place since 2022, there are a number of challenges that come along with that. We've had feedback from NHS colleagues, but also suppliers, that while it's a great concept, actually it can feel really challenging to deliver in practice. And I guess our colleagues were feeling like they weren't getting, I guess, the most of what they could do out of social value. And so the social value playbook that we published in July, we created that in the spirit of trying to give practical sort of tips and hints along the commercial, but also importantly, the commissioning life cycle, to start embedding that more as a strategic lever, as opposed to, when you get to your tender and you need to add some questions in. And kind of the really important point that comes along with that is thinking about those health inequalities, thinking about our core 20+5 model, thinking about those wider social determinants of health, and how we can draw those through all the way down from the top of the organisation in our strategic priorities, through to our business planning, to our operational delivery, and then really importantly through our commercial and commissioning commitments. And in order to do that, we've got to collaborate, as I've said. We've got to kind of, social value can't start and end with procurement. That's a big kind of weight to place on our procurement colleagues' shoulders. And we know that we struggle with contract management in the NHS. Some data suggests that a really high percentage of NHS organisations are including it in their tenders, but comparatively a much smaller percentage are actually translating it through to contract KPIs. And that's something that I guess we want to kind of turn on its head a little bit. We acknowledge those challenges, so the relationships between kind of procurement and other teams. Also this idea of quantification, Dave shared some really great figures from Cheshire and Merseyside, and that's the stuff that kind of lands well with our finance directors. But we've got to be really cautious, I guess, not to I guess, make social value transactional, even though we're trying to deliver it through a transactional process. So I guess we're quite cautious around the quantification piece, because we don't want to make it all about money. We don't want to make it about, actually, is this about, our suppliers, donating money? It's about them providing resource and skills and expertise to support our local communities. So we have this huge opportunity as an NHS anchor to start, I guess, thinking of ourselves as social and economic anchors in the NHS, not just about delivering care for the people that show up on our doors. And I think I'm probably coming to time, and I'm rambling a little bit, so I will stop there. And my colleague Kelly is going to talk a bit more about the technical side of things.
Great, thank you, Rebecca. Kelly, can you come in, please? Kelly Wilson, and Kelly, introduce yourself.
Hi everyone, hoping you can hear me loud and clear over the airways, so to speak. My name is Kelly Wilson. I work with Rebecca here in NHS England, also within the Net Zero and Sustainable Procurement team. And I actually come at it with a different perspective. I'm a procurement specialist by background. I've procured in the NHS, in and around the NHS for around 10 years. I have worked with CCGs back in the day, old money, not quite PCTs, but with clinical commissioning groups and our trusts. I've led procurement teams in that organisation, and now I work on policy and sustainability. And part of my role is to try and help our NHS teams and suppliers build these policies into the procurement and commissioning life cycles. And there's going to be a bit of a theme, I think, through what we're talking about today across the speakers. Social value is regularly seen in the functional process of procurement and commissioning as procurement's job. And that's because I think we have the models. We have those models that are issued by Cabinet Office on which we can build outcomes into our procurement processes and think about how we engage with the market in that way. So it's quite a strict way of doing it, but it is published as a procurement policy now. The key requirements, though, for commissioning and procurement is to support good implementation of social value. And that doesn't start at the tender stage. We have to really think about our internal organisation in the NHS as buyers and as what, as achieving outcomes further ahead, further beyond the product, the service, the works that we are buying. And I'm just going to kind of run through some key points for you around prompts. I think we've got a real mix of people. I've had a little look through colleagues, a lot of suppliers. We've got some charities on. I can see a lot of sort of SMEs, community providers, and buyers. So I can see there's a big mix. So what I'm just going to do is kind of contextualize some of the kind of expectations we would have in a procurement process, and then you can be more informed as you engage with that. I think for me, the core message to commercial is really to understand what it is you're buying. Some of it is very transactional, we appreciate, some of it's catalogue. But when you're really running a process that can take months and months and months, spending a little bit of time on thinking around that added value and what those outcomes could be has to start early. We need to be looking at the business need, the business case, the critical success factors of the tender and of the contract that we're outsourcing. A big thing for me is market engagement. And for market engagement, we have to treat it like a conversation. It's for commissioners and procurement teams to really hear from you, our suppliers, about the art of the possible, and for you as suppliers to bring that expertise, that knowledge, and also that experience, to support some of the to replicate some of the work that you've already done, and to help us understand how to build realistic, proportionate, and appropriate social value into a procurement process. For me, tendering is when it gets to that point where, we're bidding and expecting bids for those products, services, or works. It is more than just asking a good question. You need to know what it is you're asking for, not just how an organisation is going to deliver good social value. And I think being innovative with ideas and collaborating with suppliers, even through that tender journey, is a really good starting point to start again, to continue that conversation, to have that conversation if it's the first time. And I think Rebecca's already touched on, management of that. So once you've got that commitment from suppliers and you as suppliers have made that commitment, what we really want is our NHS colleagues, our contract owners to get it, to receive the social value and to enhance services and pathways for our citizens, for our patients, for our communities. We want them to set those KPIs, the key performance indicators, and measure the successes. We want the data and we want the case studies. So again, replication. We have almost 250 organisations in the NHS who are all independently buying things, you know, for their staff, for their patients, for their buildings, for, you know, the wider infrastructure. And so that's a lot of different approaches to procurement. And by getting that good data, those good examples, we can support our system to be more consistent in the way that social value is applied. I will summarise. I think, you know, a lot of what I've talked about, you know, Dave and Rebecca have already covered. It's communication, it's collaboration, and it's really thinking about the points in the commissioning and the procurement life cycles, about engaging with stakeholders at the right time, building things in where it's appropriate to do so, and really getting the added value that we seek from, you know, our suppliers, from you, and from our wider kind of market and network. That'll be my piece done for now. Thank you, Naomi.
"27 seconds you had extra,
There
so
you
you
go.
did brilliantly. Absolutely, everyone's done so disciplined. So Gerard, it's up to you. Our final speaker is Gerard Harkin. Introduce yourself, please, Gerard.
Thanks, Naomi. Thanks, everybody. Absolutely delighted to be part of this panel discussion about embedding social value into the health sector. But when you think about it, healthcare is actually embedded into the social value model, and I'll explain what I mean by that in a second or two. I have social value at Roche Diagnostics in the UK and Ireland. Roche is a global leader in diagnostics, so we provide diagnostic solutions to the NHS to help improve patients' lives. Social value, so there's the environment, there's the economic piece, and there's the community piece. According to research by the NHS, they drive 80% of health outcomes. And if you work in the health sector, you also know that the climate crisis is a health crisis. So I often say, if you work in healthcare, you also have to work in climate care. So social value, if we do it right, it's all about improving the resilience of the NHS, improving local communities, improving health, and reducing pressures on the healthcare system. So it's a really, really important topic. From the Roche side, we're doing a lot in social value. We've made a big, bold pledge to deliver £200 million in social value impact in the UK by the end of 2026. I'm really proud of partnerships we formed with the NHS to address health inequalities. We've got sustainable supply chains. And what that means locally for the NHS is less pollution, less carbon with our delivery vehicles coming into the NHS sites. We've got apprenticeship programs. So we do a lot of big things, but there's also kind of small things that we do, from laptop donations to address digital poverty. When we're refurbishing our office, our furniture goes into charities. In fact, there's been a load of furniture gone into the Northwest London area in the last week. But also our staff volunteering. And even if you're a small business and you're thinking, well, what can we be doing? We also encourage our staff, if they're having meetings near an NHS trust, to try and rent a meeting room from a local charity as well. So that's putting money into the local areas. There's a lot of things that companies can be doing. But I think when we're talking about embedding social value into the health sector, so two big things spring to mind for me. Starting off is what problems need to be solved. So that gives us a focus. It's appropriate that we're in Birmingham tomorrow for the face-to-face part of the conference. I was with Birmingham ICB a few weeks ago. There are significant health inequalities and deprivation across Birmingham. So that has given the Birmingham ICB, Birmingham Solihull, a focus for their social value program. So it's all about what problems do we need to solve. And we know that there is deprivation and health inequalities all across the UK. So the focusing on the big problems to solve is important. In fact, I heard a really inspiring example recently of how a group of organisations came together to address bed poverty in the Birmingham area. I know there's a big bed poverty area for young people in the Liverpool area as well. So it's about focusing on big issues and challenges. And the second point about embedding is collaboration. I'm really excited to see how there's been a shift in the NHS from social value being procurement led, where quite frankly in the past the wrong questions were being asked, so we weren't maximizing impact. But I'm seeing a lot more collaboration happening with procurement working with lab teams, the public health teams, outreach teams, green teams, to really understand what questions should we be asking in order to focus suppliers and their supply chains on making an impact in the local area. Rebecca and Kelly on the call, they did a brilliant workshop last week. I hope they're going to do a few more of those in the future, where they brought suppliers and the NHS together to hypothetically design tender questions. And I think that collaboration piece is just absolutely vital. Dave spoke about the 43 organizations that they've mobilized across Cheshire, Merseyside as well. So think focus, think collaboration, and getting on and doing it as well. I think it's easy to talk about social value for a long time, but let's just start focusing on those issues and making positive impact in local areas. Over to you, Naomi.
Brilliant. Thanks, all four of you. There's lots of questions, but I think that I'm going to take the chair's role and ask the first question. And I'd like to ask Dave something about, there's a lot of questions about, it's not just about the money, but I'm a bit interested in the money. I want to know what metrics you use, and is there a common set of metrics across England, across the NHS, so that we know we're comparing like with like?
Yeah, it's a really good point. It's one that pops up continually, especially for those people who are contracting with the NHS or looking to contract with the NHS. It's a common question, and I probably skipped over it because in the early days we're trying to avoid just it being about procurement, but it is so kind of specialised, I guess. We do have through the anchor work we've took the principles from the Marmot principles, which are dedicated to where the most challenged demographics are in Cheshire, Merseyside, and at the minute moving that kind of fiscal figure of 1 billion, because it's kind of sporadic. It's very loose and it's sporadic, but that's kind of what's contracted through Cheshire, Merseyside. So what we're attempting to do now is to highlight that and help contractors and those people who are filling in masses of paperwork to say, well, we do, this is our 10%, 15, 20% weighting, whatever it is. This is what we do, and this is what we do best. Now that might be Skillshare, that might be apprenticeships, that could be a lot of things. But by targeting those companies and helping those companies in terms of not just about adding social value to the contract, but demonstrating that social value. And again, Social Value Portal, the people who put this together, are very, very, very applied in this area and can help that. And that's where you'll see, that's where the money really matters. Because on £1 million contract, if there's £100,000 worth of social value, and I always say that painting a scout hut on a weekend is very noble. It's a very noble thing to do. It won't make any difference. Yeah, £100,000 targeted younger people's mental health, carers, those kind of things targeted in that area will make a massive difference. I don't think we're quite there yet. I mean, Rebecca and Kelly are far more kind of savvy from a procurement perspective than I am, but we're not quite there yet. But that's the gargantuan amount of money. What we're talking about is £1 billion that a minute is just floating around, not necessarily targeted. And from a perspective, contractor's perspective, they're really frustrated in terms of demonstrating that social value. So by bringing all this kind of together and inspiring that model, as Gerard said, we can start to target areas with money. As money makes the world go round, goodwill will only go so far. Targeting those areas, and the contractor gets a brilliant social value outcome, and the community gets services which, I don't know. We all read the papers. We're broke. We're skint. There's no more kind of governmental money coming down. We've got to think laterally. We've got to think how we can do this together. I don't know whether I've answered your question, but that's a kind of a passionate plea back.
Actually, I don't think you have. But I wonder if anyone else would like to contribute on that. Rebecca, do you want to say something?
Yeah, sure. So there just, to answer the first question in the simplest terms, is that there isn't a universal set of metrics that we are reporting to. And there are pros and cons to that, but I think, you know, obviously this reference to social value portal, there are other platforms available. And also, I guess, you know, you don't need to, you know, have a portal or a platform to deliver social value. I think actually the question is more about, are we clear what we're asking for? And that's, I think, where we fall down a bit, is like, do we know what is it that we want to achieve through this social value question, through this social value offer in this contract? And then we can come up with a more, I guess, nuanced set of metrics that doesn't have to be about, you know, also if we think about our VCSEs or SMEs, you know, they could be delivering all sorts of different levels of contract, but actually they might not have the resource that maybe some of our other multinational or bigger suppliers do. So how do we, I guess, so that's where the problem for me around quantification comes in, is that it can maybe create a bit more of the inequity that we're trying to address through, I guess, what it is that we're looking to promote. So I think for me, the kind of that maybe the money side of things lends itself a little bit more to, I think, the broader sustainability goals. So, you know, we're talking about sustainable and social value in procurement in our particular program, and you know, and by definition that's about like appropriate use of our resources, good supply chain resilience, looking at the whole life cycle cost rather than the fact of, you know, what's the bottom line price in this current year, which I know can be really challenging because that's the way that NHS funding to date has worked. I mean, the 10-year health plan promises a different approach to that. So I think it's more about being really clear what we're asking for, and we can only do that by collaborating with the people who are, you know, responsible for the specifications, collaborating with our suppliers, doing pre-market engagement, and kind of ask, well, what is it that you can deliver in this space? And then developing a set of metrics that could be about like hours committed to, you know, training and development. It could be looking at, I guess, where there are underrepresented groups in the workforce. It could be about considering access to green space, you know, as well as that idea of like jobs, skills and apprenticeships. So yes, that's my kind of little rant on that, I think, Naomi.
If I can come in on that as well,
Yes,
just to
please
mention the points. I think the financial piece is important, but there's much more to it. So there's the impact piece. So if we take, for example, volunteering, so it's quantified financially at 16, 17 pounds an hour. So 10 hours of volunteering is 170 pounds quantified value, financial value. But there'd be huge impact. So if I think of some of our teams going into disadvantaged areas and talking about the importance of maybe studying biomedical science, for example, joining the NHS and really inspiring kids to think about their careers and university paths in a different way. So those 10 hours could potentially change a kid's life, right? But it's only valued as 170 pounds quantified value. So I think it's more about the impact. I think we got to be careful with the financial quantification. In some cases, it's helpful. So a charity might say, look, £1,000 a year will have a big impact for us. I get that. And we do initiatives like that. But let's just look at it more broadly in terms of how we measure the real impact in local areas. Back to you.
Thank
Naomi.
you. That's really helpful. The really important question in the chat is, what are the Marmot principles? Dave, do you want to explain a bit?
I have just typed in
Right.
the chat. So Michael Marmot, probably the most famous epidemiologist in the world, is working with most of the ICBs up and down the country now, and working with their public health departments to identify the really drill down into the health inequalities, Naomi. And so Michael's been influential in turning integrated care boards and the local authorities into Marmot cities and Marmot states and that kind of thing. And it's a real kudos to have, but also what it does give us is the ability to target those areas that we just spoke about, and concentrate on those areas that have the highest health inequality, highest health inequalities, that kind of thing. And it's been a game changer for us. So we were set with data. We're data rich. We're really data rich, but we're kind of implementation still on the kind of still on the upward mark. And I completely take the point about the finances. Gerard's completely right. apprenticeships, volunteering, those kind of things, adding to CVs and all these these are morally, it's not a corporate responsibility, it's a moral responsibility, I feel, of organisations to get to. The way in is through social value. The way in to do that, the principle and the policy behind it, is through social value. And I don't think we've cracked it. I'm not going to pretend on this that we're doing some great stuff in Cheshire Merseyside, but we haven't cracked it. We're still on a journey. I think most of us are on the journey. My point earlier, what I made is keeping this on the agenda, Naomi, is so principally vital to enable organisations and a unity to come together, to target those industries. But we've still still a bit of a journey to get to.
Right. Okay. There's another question. I think there was an important question about the measurement of impact, and I think Gerard gave some really good examples about impact going well beyond the initial investment or the investment in volunteers. But can any of you give me more specific examples of impact?
I feel like I've spoken a lot, Naomi, but I'll give you an example of what I think is a true anchor. So Everton in the community. So living and working in Liverpool, whatever your colour of your team is, we have Liverpool and Everton, which in terms of economic growth and in terms of the wealth that goes back into the city from both clubs is enormous. And Everton in the community do some amazing work through the social value, and it is quantifiable. So there's been lots of studies where these kind of organisations that are supported have done their own kind of economic perspective, and £1 in gains £21 back in terms of outcome and added value. And these organisations are scattered all around the country doing some fantastic stuff, predominantly in the voluntary sector. And again, it's when we get our acts together properly and we can start to sustain these kind of organisations that are on the street, that are front facing our communities, the better we will be. And we've just got to get our act together into targeting where social value goes and how it's sustained, and organisations potentially sustaining our helping to sustain the fronts of our streets in terms of this service area. We haven't quite cracked it, Naomi.
Well, I don't think we'll ever actually crack it, but I think getting there is. There's another sort of technical question that I'm going to read out that I think is really interesting, is for clinical service procurement, I can't fully understand how the new social value model will interact with or supersede the NHS social value playbook. Are commissioners expected to follow this new model, or is it aligned with optional? Kelly, did you want to come in on that?
Yeah, I'll have a go at tackling this one. So for those that aren't aware, the provider selection regime is it's the rules on which healthcare services are now arranged. So they're no longer in scope of the procurement legislation that in a past life we were all adhering to. There are 5 key domains within the within the provider selection regime, of which one is social value. Now, the definition of social value under PSR is relatively light, and what that does is it gives commissioners effectively a bit of flexibility to ensure that their social value is delivered in alignment to what they're commissioning and their local population needs. Now, in our social value playbook, we do recommend that the outcomes utilised start with the ones that are detailed in the procurement policy note, which is the Cabinet Office model. But we do recognise that flexibility is there. And so there is something about that, again, it goes back to that engagement piece, that real early preparation work about what it is you're trying to achieve and what it is in that procurement, that commissioning activity that can deliver against the strategic outcomes. So I'm new to the Marmot principles. I had a pretty quick skim of them just now. But if there's one of those elements that your commissioning activity can support, then potentially you would align your social value to that, and that's okay. There's no one answer to this sort of question. And it really is about the subject matter, the market, the value, the complexity, the breadth. Is it a, a specific local service? Is it a wider community service? Is it multiple sites? Is it multiple authorities? Because, across the ICB, you're dealing with lots of different local councils. So you can have lots of different components of any commissioning activity. And the commissioner's job is really hard. They've got to try and pull all that together. And then that social value is layered into that and hopefully, achieves some of those added value outcomes.
Really helpful, Kelly. I've just found a whole set of other questions in a new tab, so apologies. Yeah, but I've got a very good one in the sets. I mean, they're all good. What advice would you give to a VCSE sector organization seeking to win more NHS service delivery contracts? Anyone want to pick this up?
So I can maybe kick off, but then appreciate that there'll be other experience. So I think with VCSE, so we've seen some examples recently of organizations, NHS organizations, that are actually reaching out to their VCSEs and engaging with them. So the great work in Birmingham has already been mentioned, and they went out to their VCs and their local community organizations to kind of understand what the challenges were in those areas, and kind of what the opportunities were to work with those VCSEs. Similarly, in West Yorkshire, that's an organisation we've been working with directly. They've been working with this organisation called Keep It Local, and the idea being that they've been working with their VCSEs kind of in the commissioning space, so that again they can look at, I guess, building the confidence and capability of those VCSEs. So when it comes to tenders that they can bid for, or service contracts that they can bid for, that they've got the skills and experience necessary to be able to do that. In addition, I'm sure I said maybe Dave and Gerard can also comment on this too, but there is, not in our team, but we've been linked into it, there is sort of an SME playbook being developed at the moment. So it's a bit more broad at that SME level rather than VCSE, but I think there's some really good nuggets in that about proportion. And that expectation of what can be delivered. And I think just, in terms of VCSEs and having that confidence, and by the very nature of what you're delivering, you're serving your local communities often, and so being able to kind of ham that up a bit, to kind of really celebrate how actually what you're delivering as part of your core service is kind of delivering social value in your local communities. But there might be some others who have some additional views on that.
I'm happy to comment on that as well. So in fact, I was
Thanks, Gerard.
Talking to the CEO of VCSFE a few weeks ago, and she was responding to an NHS tender. And I was just coaching her a bit on all of the impact and case studies that if you're a VCSFE, you already deliver significant local impact, but I think sometimes they might forget about that. So having that kind of a coaching session with her to really kind of pull out what are all, to help her kind of articulate the impact her organization is having and the case studies that she could put together to support that tender was a big eye opener for her. So I think that's one thing to do. And things like, I think AI can be helpful in this respect to just help you figure out and maybe look at news articles and publications that you've done to pull that together in a concise summary of your impact, because that supports your credentials as well. On a separate note, just while we're talking about VCSFEs, Birmingham, Solihull, they did a brilliant workshop recently where they brought about 15 key suppliers into a room for a day, and they had about 20 local VCSEs, and it was like a matchmaking event where they wanted the suppliers to work with the VCSEs to support social value in the local area. And one thing I'd say for VCSEs as well, working with big corporations, is just be really clear on your ask. And I said this a few weeks ago in Birmingham. I said, just make it really clear. If you want something, just tell us exactly what it is. And as a result of that, there's a couple of initiatives that we're going to be sponsoring in the Birmingham area. So make it easy for corporations to work with you as well. Back to you, Naomi.
Thank you very much.
Yes, please. Just very, very quickly. there's I'm able to share. We went out before we started on the campaign of the Anchor framework. We went out and asked the community, as much of the community we could get to, about what social value means to you, and a bit of a descriptor of what it was, and through the voluntary sector. And we had a really good, challenging debate with our voluntary sector around social value, which led to us pulling a report together with inclusive of a huge amount of the voluntary sector and all the leaders in the voluntary sector, because their argument was, we already provide added value. Social value is core in terms of what we do. So what else are we supposed to do when that's our core component of what we actually achieve? And there's a really interesting report that came from that, which I'm really happy to share. And I'm sure, and it just asked the questions. It asked the questions, the challenges, some of the outputs, and some of the solutions for the voluntary sector. So if anybody wants to, I'll put my email in the chat. If anybody wants that report, I'm really happy to share it, because it's some really good insights into that.
Thank you. I've got a question here that has 5 votes. So what are the key social value, social impact concerns for the NHS that you would like to see addressed in bid responses when you issue tenders? Is there something that is universal across all NHS trusts? This is like, help us write the bid, that are the answers, are the comments you want to see. Anybody want to pick that one up?
Yeah, I can jump in, Naomi. No
Yeah,
problem.
thank you. Thank you.
I mean, up to this point today, I think what we've said is, there's a lot of, it depends, isn't there, in a lot of what we're talking about today, because it depends on local goals. But if you're looking for that practical guidance, I'm just going to signpost you back to the Social Value Playbook, which we published back in July. We do require, and we've been quite kind of clear in our language, that net zero outcomes and modern slavery risk response should be part of core considerations wherever possible, and if not, then they are the things that we would hope to see within the social value questions. Obviously, huge risk elements related to both of those, in particularly around climate change and sort of labour practices within supply chains. So it is really clear that we're quite clear in our social value playbook that is something we'd want to see addressed somewhere within the tender. So I hope that helps in terms of practical position. I think I'll invite Rebecca to talk about that more strategic consideration.
And then I guess, yeah, on that sort of strategic side of things, I think, as I put in the chat, so it's kind of, without trying to tell people, to suck eggs, it's that, how, understanding what are the needs of the organisation that you're bidding for. So some of the broader strategic aims that we've been, shaping some of our key messages around is thinking about the 10-year health plan. The 3 shifts in that health plan, in that 10-year health plan, are all about looking at things like sickness to prevention, analog to digital, hospital to community, obviously kind of broad-reaching, quite ambitious, sort of more public health aims in a lot of spaces. And so is there an opportunity to think a bit outside the box in terms of what you deliver as a supplier through your service or products, and how, I guess, your expertise or your resource can kind of lend itself to some of those key themes. But then beyond that, it goes back to that kind of understanding those local strategic plans and priorities. If the contract value is and the term dictates that actually something super localized is relevant for that particular contract, then it might be looking about what the local population needs have been identified in that particular area to kind of give yourselves a bit of an edge on where is it that we could focus some of our energy and resource. Whereas if it's, I guess, we often get that question between, the balance between national versus local, but where, for example, you might have a smaller company, or a company that's, national, multinational, or a smaller company that's based in the south, but they're delivering a contract in Aberdeen, what's more relevant for them to deliver? Is it more kind of proportionate to expect them to deliver something along those aims in their local area, or does the value and contract term dictate that actually something local to where the contract's being delivered will have the most impact?
If I could just come in from a supplier side as well. So I agree on the carbon and waste piece, so the environmental piece. I think that could largely be across the UK. I think the local piece around deprivation and health inequalities, I'd always like to see that being local, to have the local context. So even in Dave's patch, Cheshire, Merseyside, completely different pockets of deprivation, affluency, health inequalities, etc., etc. So I think the local piece is where we get the real impact. But for suppliers as well, really engage in the pre-market engagement with the NHS. That's your opportunity to help shape what questions are being asked and to give feedback on the direction that the NHS is taking with the procurement. So please get involved in your pre-market engagement.
I totally agree. I totally agree, Gerard, in terms of that. You know, if you are a supplier and you're thinking about getting into this, you know, cracking this kind of difficult solutions, is get amongst your public health teams, get amongst the people who are setting these demographics. And I'd kind of push a little bit further. It must be an age thing, and it's the time I've been around this. There is no universal kind of offer this, but there's something about a united front, and you look at outcomes. So if from an obesity perspective, which is out of control, by the way, in the UK, if industry got together and there was a more united approach to social value, and we were able to give kids free school meals, it would make a massive dent in the health and the life opportunities of our people. So, you know, and there was, I forget who it was, I apologize to a colleague who put on, you know, the social value is no excuse for cuts. I totally agree with you. It's not, it shouldn't be something that plugs a hole, but we are where we are. You know, this is the reality of, you know, how things are in the UK globally. So, you know, it is an opportunity to do something really radical and different. And if we're just going for the same old, it's not going to, you know, we're just going to get what we've always got. So it's not just a policy. It's an opportunity for conversation. It's an opportunity for people to come together and think really differently and really radically. So if you remember anything, imagine if industry and social value helps the UK have free school meals. The outcomes of that, I can't give you the figures, the outcomes of that are gargantuan in terms of years on life on years, gargantuan. And yet the policy's there, but I don't think we think big enough. I really don't think we think, you know, imagine what we could do rather than the principle of the policy.
And
so again, I'm sorry, who wanted to come in?
No, I was just going to add to what Dave was saying, Naomi, about that kind of people not feeling like, I guess, they've got the space, the resource to kind of give this the proper thought that it needs. And I guess, yeah, that's what that call to action is to kind of really challenge ourselves. You know, it's one, and it might sound really cheesy, but, you know, for those of us who are not working on the front line of healthcare, you know, those in our procurement teams, our back office teams, those of our suppliers, you know, this is a genuine offer to kind of actually, you know, have some positive impact on the local communities we serve. And we don't often get those opportunities when we're not the people on the front line, you know, doing all our hero work. So it's thinking about it some in that context of actually, can you, you know, feel that you've made an impact in your job today, and social value can help you do that. That's a bit cheesy, so.
And I'm going to get a little bit challenging of all the speakers. And one of the things that a data that I can't remember the exact figure is how many NHS staff themselves are on universal credit because of very low wages. So are we treating our staff, treating our support workers, our cleaners, our caterers? Do we take the same care in terms of social value, in terms of the huge numbers of people who are employees of the NHS?
It's a really good question and a challenging one. So my head would love to say yes, but my heart tells me not really. So, but as part of the Anchor Institute work, to be an anchor, you have to demonstrate that you pay right through your organisation and right through your supply chain the real living wage. That's one way of us trying to demonstrate that people are above that kind of, you know, poverty level. But we've done through the Anchor work, we gather lots and lots of data through workforce and stuff, and some really good stuff, alarming stuff. So there's 83, predominantly on an average, there's 83% of the people that work in the anchor industry work locally. So you can put another fiscal kind of version on that, kind of an economic version in terms of the eating and drinking in that town, the shopping in that town, that kind of thing. So you got that economic growth. And there was something like 23% on average of those people who, even though they're working, are still living under that poverty marker. So going to work and still in poverty on an average. So, it's almost a kind of a quarter of the staff. So we've got work to do by targeting, as you quite rightly said, our own staff and keeping their health and well-being of our own staff well.
And on that, I'd say thinking about those workforces that are not under agenda for change. So, there might be the perception actually that a lot of these people who are maybe working in these in catering roles or portering roles, that they're employed by the trust, but quite often they might be employed as part of a subcontractor that's delivering that service on behalf of the NHS organisation. And that's where I think what Dave mentioned is super important, is kind of looking at our workforces, and we've got different people on different contracts. We haven't got everybody under agenda for change, and even then obviously there's challenges, for example, if maybe you're working part-time or only a short amount of hours. But thinking about actually, can we say that the people who are in our subcontracted workforces are being paid fairly as we expect through our agenda for change pay scales?
Thanks very much, Rebecca. I'm going to take another question from the list. And it's an interesting one. They're all interesting. This is, are we in danger when focusing on assigning a financial value to a social outcome that we lose innovation and the USPs that organizations have? I wonder if I can ask Gerard to come in on that.
Yeah, Richard, I think it's a great point. And so there was a tender recently, just to kind of maybe illustrate this point. There was a tender recently where it 10% weighting for social value, and they're using a number of different measurements. And they said anyone who delivers over £500,000 over the lifetime of the contract will get 8%. And the additional 2% was for case studies and delivery plans and things like that. But you could think 8% for £500,000 worth of social value delivery. And they had a number of different measurements to achieve that £500,000. And to your point, Richard, I think it can really limit the creativity and the innovation of suppliers, because it'd be aiming for that specific quantified value using specific measures instead of maybe thinking bigger and bolder and more from the impact side. So I definitely think it can give focus from time to time, but I think we got to use that carefully, because I agree it can limit the creativity of solutions. And maybe if I just touch on really inspiring example I heard recently, because I think it kind of touches on this. It was up in Birmingham. They're talking about bed poverty, but multiple organizations got together to address bed poverty. So a big laundry company, I think they call it Els, and there's a hotel chain. There was a kind of a utility company that had vans driving around the city that could transport the equipment. I think it was a construction companies. The teams were able to go in and build the beds and all these kind of things. So that was groups coming together to address a big local issue. But if it was just a quantified financial value that each company was aiming for, I don't think we'd have been able to explore that bigger creative opportunity. So I kind of agree with you. I think we've got to be a little bit careful and encourage real creativity from our suppliers. And part of that comes back to focusing on what are the real problems we want to solve in the local area. So for me, it always starts.
So we are just out of time. Can I just thank the audience for great questions and apologize for those we didn't get to because I was so inept with the technology to begin with. But thank the speakers, thank the audience for great questions, and thank you all for a terrific session on the importance of social value in the NHS. Thanks very much. Bye-bye.